Welcome to Health for Life, your trusted source for health and wellness insights, proudly presented by Vitruvian Health, the comprehensive healthcare system serving Northwest Georgia and Southern Tennessee with leading entities like Hamilton Medical Center and Bradley Medical Center. We're dedicated to keeping our communities healthy and thriving.
Welcome to Health for Life. Today we're talking with Dr. Ashish Kabir, board-certified neurologist with Hamilton Physician Group-Neurology at Vitruvian Healthcare System. Dr. Kabir, thank you for being here.
Thank you. I'm really excited to be here.
So could you start by explaining what Alzheimer's disease is and how it differs from just normal aging?
Sure. I'm really glad you asked. This is an area topic that I'm very passionate about. So if I get overly excited, I need you to rein me in. But I would love to discuss this because not only is diagnosing and understanding Alzheimer's so important as our society ages, but also, there are so many treatment options now that there weren't before that really ignoring the problem is really very, very almost criminal in some ways. So basically what Alzheimer's disease is it's a disease that causes your brain cells, typically the cells that are responsible for memory, to die. That's why you have memory loss. Memory loss is typically not a normal part of aging, and Alzheimer's is basically a progressive, what we call neurodegenerative disease, by which I mean the neurons, the neuro of the brain basically just kind of dies and degenerates, and that in turn leads to impaired memory and eventually thinking, behaviors, etc. As I mentioned, Alzheimer's basically involves brain changes and the formation of plaques and tangles, and what's interesting about it is it's the most common form of dementia actually in older patients, and so very commonly seen.
It's something that's always interested me with hearing, dementia, Alzheimer's in general. I can never understand what the difference was between the two.
I'm really glad you asked that. That's a great way of actually kind of introing what I wanted to talk about. So if you want to think of dementia as sort of the overarching term, if you prefer, a lot of people, there's a lot of societal context to the term dementia. I honestly prefer memory loss, or as we use it in the clinic, cognitive impairment as terms. They all mean roughly the same thing. But what dementia is, or cognitive impairment or memory loss, is basically difficulty with tasks and memory and those sorts of things, right? Just basically my brain isn't working right, if you want to think of it that way. Many things can cause this. Some of these things are reversible, like vitamin deficiencies and, traumatic brain injury and all of those kinds of things. Some of these things are not. And the things that are not are diseases like Alzheimer's disease and frontotemporal dementia, which we'll get into a little bit more as we talk. But basically the idea is that if you want to think about it as, your elbow could hurt because you hit it against the wall or because you have arthritis in the joint itself. Alzheimer's is the equivalent of having arthritis in the joint, and there could be other reasons why your elbow hurts too, right? Does that make sense a little bit?
Yeah, it does.
Yeah.
There's obviously signs of this developing. What are some signs that people should watch out for?
Honestly, the signs vary by stage, but anything that disrupts your daily routine, difficulty with performing familiar tasks, confusion with time, place, repeating questions, and of course, mood or personality changes or anything more serious like seeing things that aren't there or hearing voices, all of those are definitely very concerning.
Once these signs are appearing, how would you go about diagnosing it?
Right. The steps in diagnosing a disease like Alzheimer's or really any memory disorder or cognitive disorder is to first kind of notice the symptoms themselves in the home. Usually it's a loved one or someone who regularly sees the patient that first starts noticing symptoms like, that was odd. I wonder why that's happening. And you start noticing patterns. And then eventually this typically leads to a visit with your primary care physician who, may do some tests in their clinic and if necessary, refer the patient to neurology for further evaluation and assessment. The tests in the primary care physician's office typically include basically paper-based memory tests where we ask you to remember 5 words and tell them back to us in a few minutes, for example, something like that. Or they might ask you, are you having trouble with managing your finances yourself or something else along those lines, right? That sort of thing. So those are questions that your primary care physician might ask. And they may also order an MRI, which is an imaging study of your brain that can look for changes, and also blood tests, which nowadays have gotten very sophisticated and can really help distinguish causes that we can fix from diseases like Alzheimer's disease that maybe we can't fix, but we've gotten very good at controlling. And I'd love to tell you more about that as well. So
yes, I mean, just being able to control this, how do you treat memory loss?
Sure. So I think the first and most important thing is to try to make sure that you're addressing the problem that the memory loss is causing. So you're going to the grocery store and you're forgetting things, people start using lists. You're forgetting names in conversations, you make sure that you have those things handy when you have the conversation. So usually behavioral interventions are an important first step. And then you want to make sure you go for as healthy a lifestyle and as cognitively stimulating a lifestyle as possible. Sitting in front of the TV, watching reruns of whatever, I'm going to date myself if I name shows, but, I think those things tend to worsen these conditions. So when you basically anything that keeps you active, this is definitely something that caregivers and loved ones and family members really have a hand in sort of, making your life easier, right? So, for example, as cognitive impairment progresses, oftentimes driving and managing finances can be difficult. So really, getting ahead of that and making sure that, we have a plan for addressing those changes that can be very helpful. And then, of course, there's the medications. For Alzheimer's disease in particular, the Food and Drug Administration has had approved medications for more than 10 years that help the progression of Alzheimer's disease. But what's really exciting is that in the last couple of years, we've really started to understand what exactly happens in terms of changes in the brain and have taken steps to address those changes. And we've seen some really great success with the newest medications in the class of what we call anti-amyloid therapies, which basically target the abnormal changes in the brain that lead to Alzheimer's disease. And we've gotten to a point where, we can interfere with those changes and prevent the progression of the disease. So very exciting times in terms of treatment.
When it comes around to dealing with a loved one being diagnosed, I mean, what's some advice that you could just give to families out there?
The most important thing to remember is if you think it's abnormal, it probably is. I think like with most medical diagnoses, if you're feeling that something's off, please ask. The worst we can say is, I see this all the time. Your medical professional is trained to rule out things that may contribute. For example, depression may contribute. Hearing loss or vision loss may contribute to, memory, cognitive issues. These are things we can address. So if you bring them up, then I think it becomes a lot easier. A common thing is hearing loss, actually. And the other thing that we see a lot of that contributes to cognitive impairment is pain. In fact, the American Academy of Neurology asks you to ask your patient about pain contributing to their cognitive and memory issues all the time because, if you're constantly either in pain or taking medications for pain, both of this can make processing of everyday tasks much harder for you, right? And this is treatable. We can treat pain. We're pretty good at it, actually, I think, and we can treat depression. We can treat hearing loss and we can treat vision loss. We can treat technology problems. So there are lots of things that we can do. So I guess my advice is ask. Is this something we can do something about? That's what your relationship with your physician is all about.
When it comes to also dealing with Alzheimer's once somebody has it, not even once somebody has it, maybe leading up to it, are there certain lifestyle factors or just things in general that might increase the risk?
Yes. You're not going to want to hear this from a doctor, but stop smoking. Anything that leads towards a more healthy lifestyle has actually pretty good data. The Mediterranean diet has pretty good data.
I've heard about that.
Yes, yeah. So, focusing on, lean proteins and just healthy fats in your diet. There's a study that looked at aggressive lifestyle interventions, including diet changes in patients who were at risk for Alzheimer's disease. And it turns out there's a very significant improvement if you exercise, if you eat right, and if you try to take care of the rest of your health towards the development of Alzheimer's in particular, not just, he's just tired all the time or she's just, sad all the time or whatever. It really does seem to lead to those actual changes in the brain that we see in Alzheimer's patients. So really very, very important to take care of those lifestyle factors.
Does age have a big impact in this? Like as you get older, are you just more prone?
Age is a very strong risk factor for Alzheimer's disease in particular. Unfortunately, not a lot you can do about age, otherwise I would have. But there's many other things to think about as well. So family history and genetic markers are a part of this. Something we call vascular risk factors or small vessel risk factors, if you like. And these are diabetes, cholesterol, hypertension. These are very important factors to control. And then inactivity, poor diet. These are very important things to address as well.
And when a family is dealing with a member that has Alzheimer's, what are some stages that they need to look out for?
Yes, I'm glad you asked that. So basically, all cognitive impairment, all memory diseases, we classify into normal, mild, moderate, and severe. Let me try to give you an example, I think, that might make these things a little easier. To me, in my mind, early or mild cognitive impairment is basically memory lapses is the primary symptom. You can't remember somebody's birthday or someone you really are close to, their name. Word-finding difficulties are a common finding at this stage. There are objective tests that your primary care doctor or your neurologist can do that kind of can more effectively classify what stage you're at. But early is usually pretty easy to quantify because the patient looks fine. They just seem to have more trouble with this memory thing or trouble with that. When you move towards moderate, that's when you see a neurologist and the neurologist is saying, are you really sure you should be driving? Are you sure you should be handling finances by yourself? This is the stage where you have greater difficulty with tests, but you can still typically go to a restaurant with friends. You're not really making huge changes in how your day-to-day life is going, maybe a little bit. And then you start to get near the late middle stages, you start to notice some behavioral changes. Late stage or severe cognitive impairment patients basically often don't live by themselves anymore. That's or completely independently. Sometimes they live at home, but usually either have a caregiver or someone staying with them all the time. And what I think that we really need these stages for is if you diagnose that this is the disease, well, on average, this is how fast someone should move from mild to moderate to severe. And this really helps families in the planning process.
Tell people about, the services that you can get at Dalton for people seeking care.
So I'd like to, brag a little bit, if you'll let me, about Hamilton Physician Group's neurology group. We, I think, provides really the latest in memory care right here in Dalton. I would posit that we were very early adopters of the latest technologies. Our community, our patients, the people who see the hospital as their medical home, they had been crying for a long time for answers to this cognitive impairment problem. And I think we've really tried to step up. Hamilton Physician Group-Neurology consists of physicians, advanced practice providers, nurse practitioners, and PAs, and a number of very specially trained staff who diagnose, treat, and manage. We work very closely with other providers and teams at Hamilton Medical Center and at Vitruvian Health, which covers Cleveland as well as Dalton. Basically, what happens is our office will evaluate the underlying cause of your cognitive impairment. Our office will basically lay out your options. And here's my favorite part. We're very strongly integrated in the cognitive impairment research community. So even if we don't have an answer for you today, we are able to partner with major institutions to try to provide, basically, are there research trials or anything like that may be an option for you. To put this in perspective, we offer the latest treatments that I talked about, what we call anti-amyloid therapies for Alzheimer's disease, to one of the largest groups of residents of Northwest Georgia. Really, our numbers are up there with some of our Atlanta colleagues and others. And for a hospital system our size and for a community our size, being able to offer that has been really, really humbling and really a great source of happiness for our group. And we're very proud to be able to say that if it was our family members, we'd be excited that we'd be able to offer those treatments here. So
That's really exciting. And thank you for joining us. Once again, it's been a while since you last came on.
Yeah, I mean, I've been here, which has been really fun, building some of these programs with some of our colleagues. So big shout out to everybody at Neurology and everybody at Hamilton who have been such a great part of this and have put up with Kabir wants this done a lot,
Yeah.
and I think that it's really been a pleasure, being able to work with everyone around here.
That wraps up today's episode of Health for Life. If you or someone you know is concerned about memory changes, consider reaching out to Hamilton Physician Group-Neurology. Visit Vitruvian Healthcare System's website at vitruvianhealth.com or call their office at 706-275-6121.
This program in no way seeks to diagnose or treat illness or to replace professional medical care. Please see your healthcare provider if you have a health problem.
Thank you for listening to Health for Life, a presentation of Vitruvian Health, formerly Hamilton Healthcare System.